So back to the meat. I'm working with Georgia Tech University in supporting me in this work in the United States. And they've got some real innovators that I've worked with over a number of years, and we've written a number of books about some of our thoughts in this space over the last few years. So we've developed, we believe, a really good understanding of the whole discipline of how buildings work and people move through them. And I've got a little extract from a document here where we were studying an outpatients department. And what we were looking at was the probability of accommodation being underutilised. No one could say it will be like this or it will be like that, because there are so many factors, as we know in a process and how facilities are used, that will determine the occupancy. But we can look at the probability. We can look at the variables on the process, and we can do the what-ifs, and we can establish a range of occupancy probability, if you like. So we could say there's a 90% probability that at least 16 rooms will be unused, and a 10% probability that all the rooms will be unoccupied. The results can also be translated as, for 1 out of 10 days there will be 20 or 25 rooms available, and for 9 out of 10 days the department will have at least 16 unused rooms. Now that, I reckon, is really useful information, because it then says what is it in those processes that's leading to this underutilisation of space. And what do we have to change in order to get that better utilisation? And for those of you here who are trying to manage your estate and sweat your assets, it's this kind of knowledge that I reckon would be really interesting to understand. We can translate it in a direct comparison between how you calculate occupancy from the health building notes and what we've done. So if you build up all the accommodation with all the occupancy from it, you get 79 people. But from our study, which is based upon trust forecast data, electronic patient record system data, we've gone into all of the data, and this is my software hat on, to get trust actual data, and then we'd run that through the process model such that we understand the organisational processes going on that are moving people through the facility, what the forecast demand is, how many visitors are coming with that patient typically, the staffing need, etc., and it builds up to that. And this was the initial flag saying, even just in that one space, we've got an overestimation of 35%. And we see the peak occupancy. Peak occupancy, all engineering systems are designed on the basis of peak load. Peak load is driven by peak occupancy. So that's the significance of actually understanding the peaks. But the peak is also influences your energy consumption. You pay a peak load tariff through 11 o'clock in the morning to 2 o'clock in the afternoon. And my thesis is, if we're able to control the processes that lead to the occupancy, we can then manage occupancy, drive it down. Now, it's been well understood that over the years, and with the smart grid coming in, major consumers of energy will be charged a premium on these peak load tariffs. So there's every incentive for trusts to look at how they can manage the peak loads. But what we also did to prove the thesis, which is, can we manage peak in order to smooth the load? And by smoothing the load, we reduce our consumption and we reduce the need for major plant. And so that's what this study has shown. We showed that by jiggling departmental processes around, we could reduce that peak by 23%. Now, when we then look at the consequence of occupancy on how the facility will be used, we say if you can control the facility with a significant level of diversity, you should be able to significantly reduce your energy loads. So we're working with one of the UK's major environmental engineers at the moment on this new hospital. And when I showed them our results, they said, we had never appreciated this level of diversity of use. and therefore the need, what's called modulating the delivery of services through the ceiling, air, cooling, heating. And this would have a radical impact on our scheme. We've modelled that impact, and we showed that on a like-for-like basis, we could halve what their projections were if you operate the facility according to the known uses. So we're saying part of this work is to have a much closer understanding between occupancy and the way that you control the facility. And that translates into, this is a model of the facility that we've been working on, in terms of the occupancy, how it impacts the energy consumption profile. And just to delve into that a little more, here is a typical profile through the day of energy consumption made up of all of those components on the right-hand side there. And can you see the blue line that follows that? That is the occupancy profile of the facility. And you can see typically, this is a result of European research, that typically buildings are being serviced outside the occupancy period. And that goes right across building types. So therein lies the potential to control all of that wasted servicing. So taking it a bit further, one could say that departments would be operating on different schedules if the facility was organised around the different departments. And is there not the potential to work with the clinicians, the service managers, to see how we can manage departments? Why should I open a specialist department on a Saturday morning and have another one open over here and expect to fire up all the services in that facility and consume all this unnecessary energy? This shows us how we can manage the sequencing of use within the facility, but also to share potential capacity between departments that got similar kind of services available to the patients. And outpatients, for those of you really involved in outpatients, will know that there's lots of opportunity to do that. Reduce capex because we've got smaller plant that we require, but we're also reducing our operational costs because we're obviously not running as much as we need to. So it's a win-win situation. So occupancy analytics informs how to manage the operational processes to achieve best carbon performance. Operational processes, it manages the resources needed and the process and resource constraints. You remember the people moving through the facility. That's a reflection of the process. So we forecast those flows such that we can understand where people are in any part of the facility any time of the day. And then planning and design teams now have data that they can use in the planning and design of the facility. And it's in this area that designers have to make these massive assumptions. And I hope you've now convinced that it's these assumptions that lead to this big gulf between the designer's aspiration for performance and the actual outturn energy performance.